Hello, my name is Katia Machado, and today I'll be talking about the roles and responsibilities of the registered nurse. This will include the recent changes and their impact on the roles and responsibilities of the registered nurse, the roles of the nursing, midwifery, council in relation of the nursing practice, the implications of the code on nursing practice and the role of the registered nurse, the need for effective communication in multidisciplinary healthcare settings, evaluation of the effectiveness of the multidisciplinary approach in the healthcare settings. So what is a nurse? After earning a 3 years university degree in a healthcare context, nursing is the practice of giving education highly specialized care to injured, ill, or disabled persons. With a high level of care, including the avoidance and suffering and agony, nurses can treat a wide range of illness and conditions. According to Roach, who developed the 5 Cs, which include compassion, competence, confidence, conscience, and commitment. This allows nurses within every job sector to be able to manage every situation and patient to the fullest of their potentials. The recent changes and the impact on the roles and responsibilities of registered nurse. In this slide, I'll be talking about the technical and scientific advantages, the social, political, economic, cultural, and ethnical factors within a registered nurse role. The functions and responsibility of a registered nurse are always changing due to a variety of reasons that influences the continually expanding and changing nature of the profession. There used to be a lot of overlap between nurses' duties and a list of domestic tasks, but over the past few decades, this has radically altered. As a result, of several circumstances, including improved training that altered women's perception and the ongoing demand for medical experts. Nurses' roles have changed. Nurses began to learn tasks that previously were reserved for the doctors. When training for nurses became more extensive and required schooling, consequently, physicians could concentrate on a higher level of education and nurses can make more decisions for patients. Due to extensive training and reward experience, nurses now have more responsibilities than ever before. To help nurses manage medical emergencies without calling the doctors, educators are putting more of an emphasis on teaching them how to do so. Instead of being seen as a doctor's helper, the profession is now commonly thought as an autonomous clinical with medical knowledge who can manage and provide the best outcome possible in challenging circumstances. Nurses are now prescribed with patients with medication, make clinical judgments that carry a lot of responsibilities due to ongoing, ever-changing demands brought on by increased number of patients who require great levels of care. There are 4 specialist categories with nursing, which consist adult nursing, which is working with patients above the age of 14, pediatric nursing, which works with the patients below the age of 18, mental health nursing, which is working with patients who have been diagnosed with mental health illness, learning disabilities, which is working with patients in all age who has been diagnosed with learning disabilities to be able to give them a special care are when they are hospitalized. This enables patients to obtain the greatest care from a professional who has received training and skilled in a various field they are dealing with. Care is tailored to their unique needs. Technical, high-quality healthcare systems mainly depends on a clinical record notes to preserve all potential clinical data and maintain records for future use by physicians who will need these notes to comprehend the patient condition. For record keeping and confidentiality purposes, paper patient charts were handwritten and stored on a specially made shelf before modern technology was invented. Electronic systems have been employed to record patients' information more frequently over the course of the late 20th century. This has greatly benefit to the healthcare industry as a note were produced and saved in an electronic system, altering the procedure and enabling the system's computer to the clinical notes. Patient care. There has been tremendous growth in a nursing profession over the last few decades. Because of its history adapting its surrounding, it has been showing can change within the times. Thanks to advancements in the field, nursing has gone from beginning of a poorly respected profession, one of the deserves the greatest from the both nursing and patients. Since 1940s, training healthcare environments, expanding responsibilities, nurses, cultures, and patients' care will have improved, saving countless lives and establishing nursing as a respected profession today. The roles of the Nursing and Midwifery Council in relation to the nursing practice. In England, the organisation in charge of regulation and establishing the standards for the nurses and midwives is the Nursing Administration, also known as NMC. It evaluates the education, training, conduct, and performance of nurses and midwives, with the help of its members. In December 1919, nurses were required to obtain a license that they were able to practice. It has been recognized as the Nursing and Midwifery Council from 1st of April 2002. As part of the system, nurses can encourage high standards of education within the nursing profession, allowing them to continue ongoing their skills throughout their careers. Nurses will be allowed to register annually under a new regulation that will allow them to provide CPD, continuous professional development plans, throughout the years, ensuring that they were improving their clinical abilities considering the ongoing changes in the healthcare environments. Every 3 years, a nurse registration must be renewed to continue practice as a nurse. After the registration expires, the nurse is required to complete 35 hours of CPD throughout a variety of online courses, in-person learning opportunities, and other nursing-related activities. Nurses who do not report their CPD hours and verify them on the NMC website, their unique registration code will be investigated by the NMC and formal hearing will be requested. Depending on the outcome, the member may be subjected to a more serious sanction, such as suspension, impulsion, and their misconduct can be publicized. The NMC also has authority to compose sanctions, court suspension, and striking of orders. This is to improve public protection and also rules, regulations, and to enable nurses to be able to follow clear systems to be able to practice within the guidelines. The implication of the Code on nursing practice and the role of a registered nurse. The Code of Conduct consists of several statements that, when taken as a whole, capture the core of what course midwives and nursing assistants should do in order to practice in a morally upright and ethical way. The code of practice includes: you must treat people as an individual and respect their dignity. You must treat people kindly and considerately. You must act as an advocate for those in your care, helping them to assess relevant health and social care information and support. You must not discriminate in any way against those in your care. Employers and unions will be able to observe the code and act responsibly and professionally when conducting compassion at this time by enforcing it. The NMC makes sure that registered nurses and midwives are qualified and use their relevant abilities in a consistent manner in accordance with the standard expected to protect the public safety. This results in a patient feeling that their private information and what they discuss with their doctors will be handled confidentially, and the action will be taken if this isn't done properly. Discipline may be applied in the court and is not followed. Misconduct and unsuitable conduct are no couple of instances. The medical professionals runs the risk of losing their entire registration and begin unable to continue practice in their jobs if they fall short of code of criteria. The 4 P's of conduct consist of prioritizing people when we need to respect patients' individuality and respect their dignities. Practice effectively, which is communicating with others clearly, respecting others' views. Preserving safety, which is making sure knowledge is fully acquired prior to beginning a new job. Accurately recognize, taking in evaluate the individual's normal or struggling mental health, and to take appropriate action as needed. Promote professionalism and trust. Keep high level of professionalism and or at all the times to make sure you are following the rules, and be conscious of how your action can have a significant impact on the need for effective communication in a multidisciplinary healthcare settings. The multidisciplinary teams of healthcare workers. Multidisciplinary teams are made up of different specialists who combine a variety of talented and knowledge with the goal of providing patient-centered care and achieving appropriate and gratifying outcome for each patient. Each position with the multidisciplinary healthcare settings has a responsibility to represent, provide for the patient and best interests and care. There are various jobs in the field which include the following: nurses, doctors, care coordinators, social workers, paramedics, receptionists, and many, many more. To connect the separate tasks and produce the best possible care for each patient, a component of multidisciplinary teams are recognized and understands their roles within their respective field of expertise, providing patients with the support that is specially suited to their needs, as well as comprehending the unique circumstances of each patient and creating a strategy. The evaluation of the effectiveness of the multidisciplinary approach in healthcare settings. Using a multidisciplinary approach entails bringing together experts from various healthcare settings to create the best possible patient care plans by fusing their distinctive and effective system. Since we are all unique human beings, the healthcare professionals will have a wide range of abilities, approaches, and skills. Teams can come together in this way to listen to one another from the best team possible, break down each problem efficiently, and provide the best results for the patients. Successful characteristics of a multidisciplinary team should include a good level of team understanding and what each role and duty consists, high standards of team collaboration in order to create and maintain an efficient team, clear and excellent levels of communication within the team to be able to create the best program for the patients to be able to achieve them. Every person within the team to be able to understand their own roles clearly, creating an easier system for the process as a whole. Now we'll be talking about the advantages and disadvantages within a multidisciplinary team. Advantages. This can improve the quality of the patient's all-around care and outcome to the situation. The role of each employee is to find and work procedure are streamlined as one having eyesight from multiple perspectives, one on the same topic, to be able to come to a conclusion which best suits to the situation and patient. Constantly learning from colleagues due to a different communication and handling techniques. Build a strong, interesting teams which encourage good teams, decision making and better work lifestyle, also job satisfaction. Disadvantage. Individual will have different backgrounds and opinions and views on the topic which could be a positive and or negative. The costs, poor communication between colleagues, lack of understanding between workers. While this system has both benefits and drawbacks, I think the benefits outweigh the drawbacks. The wonderful thing about patient-centered teams is that they break down each position into a smaller, more focused roles, allowing teams members to learn from one another and develop new abilities. Working in a healthcare industry becomes less stressful and more gratifying when these processes are in place. We are implemented and complemented by professional attitude and an open-minded mentality. Additionally, it gives a patient a better chance to receive the best medical care possible because it has been developed by numerous people with diverse backgrounds. And that's all for now. With this project, I've gathered more understanding of the roles and responsibilities within a registered nurse role, and I hope you have too. I would like to say thank you for taking your time to view my presentation.